Treatment of cancer-associated thrombosis there's a few different options. There's Coumadin, which has been around forever, but there's problems with Coumadin. Maintaining the INR is an issue, and then patients need to be on different types of chemotherapy drugs, and that can interfere with the levels of INR. So it's really important that we find better anticoagulants to use. And one approach has been to use low molecular weight heparins, which was initially used just in the hospital, but in cancer patients they're used in the outpatient setting as well. And more recently, novel oral anticoagulants or direct oral anticoagulants have come on board, and they're much more patient-friendly. They don't require monitoring. They're 1 pill a day or 1 pill twice a day, depending on the type of anticoagulant. So they're much easier to manage. Currently, ASCO and other guidelines recommend low molecular weight heparins as the standard of care. And what we wanted to do was sort of try and figure out what's happening in the real world and what are patients and physicians actually doing. What we found was that the standard of care low molecular weight heparins only used about a quarter of the time. Warfarin, the oldest anticoagulant in the setting, continues to be used about half the time, and then the newer anticoagulant rivaroxaban has been used about a quarter of the time as well. So a lot different is happening in the real world. I think partly it might be driven by cost. Costs for for injectable drugs can be high, and direct-to-patient costs can be high, and that's one possible reason. It is a daily self-injection, and it's challenging to use, so patients may choose not to use it, and there may be other factors in play that we don't completely understand. We want to deliver appropriate therapy, but we want to be mindful of patient preference and cost as well. So sort of assessing risk and finding making sure the high-risk patients get the more intensive anticoagulation strategies, and the low-risk patients are managed more appropriately in a patient-friendly manner is the best way to go.